Hello and welcome to this live Facebook discussion. I'm Hartford Healthcare's Tina Verona. I'm so happy to be joined by Dr. Devika Umashanker. She's an obesity medicine specialist here at Hartford Healthcare at the Center for Metabolic and Surgical Weight Loss. So thank you so much for being here tonight.
Thank you for having me.
Appreciate it.
Thank you.
A lot to get to. Of course, we're hitting the holidays, and this is a popular time where, people are consuming a lot of calories, and then of course we hit the first of the year, and then everybody's New Year's resolution is to lose weight. Let's talk about, I know dietary supplements, you can go into the stores nowadays, you can see, it can be overwhelming what you can see in terms of dietary supplements. How do you know what to choose, what's right? How do you navigate these waters?
Sure. So I am actually not a big supporter of dietary supplements just for the fact that they're not FDA approved and they're not FDA regulated, I should say. So they don't go through a very stringent process such as prescription drugs go through. So these active hidden ingredients that they can have can be very harmful, can cause cardiac arrhythmias, things of that sort. So I tend to tell my patients to stay away from dietary supplements, and if they have more questions, to speak to their providers.
Yeah, because you know what, it can be easy to sort of get caught in that vortex because you're going down the aisle, you're seeing, vitamin B12, you're seeing magnesium, you're seeing all these things that are healthy, and the packaging looks good, it says organic, it says healthy, so you think, well, how could this be harmful?
Yes. Dietary supplements are different from vitamin supplements and mineral supplements, and I think there is a role for vitamin supplements, especially for individuals that have, for example, weakening of their bones, like elderly patients where they have osteoporosis. Vitamin D supplementation definitely will benefit them. Women of childbearing age should be taking folic acid to prevent and protect their babies from certain fetal defects that they may have. And even individuals that have a history of gut disease, by that I mean celiac disease, Crohn's disease, where they're just not absorbing the vitamins and minerals that food can provide for them. There's a role for vitamin supplementation, but otherwise, mostly people, if they have a healthy, balanced diet, they should be fine with all the vitamins and minerals with that.
And I want to talk about your specialty. You're an obesity medicine specialist, an internist, embedded into our medical and surgical weight loss program here at Hartford Healthcare. That's a highly specialized area of focus, and one that is so important, and one that is kind of rare, somebody like you, but nonetheless so important as people are going through this process. Tell our viewers right now who are watching, what exactly is an obesity medicine specialist?
Sure, absolutely. So what I do is I work with combination of different individuals that are interested in weight loss after they have bariatric surgery, individuals that are not interested in any sort of surgical intervention and are looking for medical weight loss, or they're medically complicated where they're not eligible for surgery and they're looking for an alternative way. What I do as an obesity medicine specialist is I provide nutrition counseling. We use medications if we think it's appropriate for the individual to help assist with their weight loss journey, and also discuss the role of exercise when it's appropriate.
And it's important, I think, to note that whether it's medically or surgically, two totally different avenues in terms of the weight loss journey, but yet the same in terms of the commitment on the part of the patient.
Absolutely, absolutely. So what I tell patients is medical weight loss, surgical weight loss, they're just tools. They're not a substitution to nutrition as well as exercise. It just gives you a little bit of a push to get where you need to go, but all the other elements need to be in place to optimize your weight loss.
Absolutely, and that's what you're there for, to sort of guide. You're there with them every step of the way on this journey, because you pardon the pun, it's not really a one size fits all. Is that when you're going down this path, you do need to make adjustments along the way. And that I'm sure you see a lot in so many patients, right?
Absolutely. That's why we ask patients to come and follow with us very consistently on a consistent basis. What we know is the first 6 months when someone joins our program is when they get the most weight loss. So we ask them to come every 4 to 5 weeks to make sure they're reaching their goals, make sure that they're not having, if they're on medications, any side effects. And if they're hitting some barriers, how can we help you?
And these are lifestyle modifications that are not easy to make. Let's face it, it's losing weight is not easy.
Sure.
It is a commitment. How do you get patients past that hurdle to start seeing those results and to stay motivated?
Yeah, so when they first come and speak to me, on our first visit, I tell them what their expectations should be like. I let them know, our program is not going to give you that 15 to 20 pound weight loss within the first month. Right. It's going to be a journey. It's a lifelong journey. We walk you through each step of the way, and we're here by you. If you have any questions or concerns, we're always available to help you.
And I think it's also confusing too, because you see all the ads, all of the marketing saying, you can take this pill, you can lose weight, but you really should know that there is no magic pill to lose weight immediately. It's not going to happen overnight.
Right.